Hello, everybody. Thank you for joining me today. Thank you for joining us on the Apparent Voice. This is our Tuesday show. I don't know the date. Forgive me. It's a pandemic date, so Tuesday in August. So thank you for joining us. I would love for everybody to go in and like and share our live chat for today. We have some a special conversation coming up in a few seconds between one wonderful doctor, Dr. Fuller from U of M. She is a virologist who has been on the show before, and she's helping us kind of navigate this process of COVID and how it looks and what people should and shouldn't be doing. There's one thing to read a lot of stuff, and there's one thing to like keep going to websites and hearing how the virus is progressing and how it's constantly changing and what schools and everything should do. But there's another thing to have a specialist, and Dr. Fuller has agreed to be that for us, just out of the goodness of her heart, like literally a virus specialist who will actually talk us through some of this process, right, and how we're interacting with our young people. And today we've dedicated today's show specifically for early childhood educators and homeschoolers. And the purpose for doing that is because a lot of the early childhood educators have had support systems, and they've seen a lot. They've been on town halls, things like that. But to have a moment with a virologist is something that I felt like was key and would be so beneficial to the early childhood programs, because they have been our frontline workers, like really, really supporting families who have to work during this time. I know that a lot of the programs are already open, and they have staff and team members who are there, and they're trying to navigate this, right? They are trying to figure this out. And in trying to figure this out, it will behoove me not to utilize the resources that we have to help them figure that out. And so first I'd like to invite Dr. Fuller on, because we're only going to talk briefly because I want the early childhood educators to have that time to really ask as many questions as they have and to learn from Dr. Fuller's expertise. So thank you, Dr. Fuller. You are on mute. Thank you. Thank you for joining me today.
Good morning. Good afternoon. It's good to be here. Thank you for the invitation again.
Yes, thank you. Thank you. And so as usual, you always come through whenever we're having anything. And I thank you first of all for that. I thank you for your willingness to be open and transparent with the community and with the people that we work alongside of. And especially today for, touching bases with our early childhood educators. You said something on the first show that you were on with me, and you were talking about a child care provider that's in your family and how their cases have been none, right? And that was like, wow, like if I could give the opportunity for early childhood educators to hear this and talk about what their concerns are with you, because I know you're totally transparent, that would be a wonderful opportunity. So, so with that, for those who don't know you, introduce yourself. Go ahead, tell them more.
Sure. So as she said, my name is Ovita Fuller. I'm a virology professor at the University of Michigan in the medical school in the microbiology and immunology department. I did laboratory research for about 20 years on herpes simplex virus and trained PhDs and dental students and others. And then about 15 years ago, I began working with religious leader networks and communities in the US and Southern Africa to get to them what scientists and physicians and others have learned into the community and to the people who need to practice these. So essentially it's implementation. It's great to know these things, but it's even more critical that people who need to use them understand and can apply what is learned. And so Bernita mentioned it was out of the goodness of my heart. It's not. It's what I do. This is what I do as a virologist and as a scientist. So it's very important that people get a message that they can trust and count on, that is for the best interests of the people who are being who are involved.
Yeah. And our early childhood educators have invested a lot into their programs, their centers.
Absolutely.
to make sure that our children are safe. And it would behoove us not to kind of give them tools that they need to make sure that not just their programs are safe, but their children and themselves are safe, right? And
Absolutely.
and because we want them to go home at the end of the day, we want them to go home to their
Absolutely.
families virus free. We want the children to go home virus free. So we really wanted to. I'd love to introduce our. We're gonna go. I'm not going to ask too many more questions. I may open it up with a question and then let the ladies and the gentlemen go ahead forward and ask their questions.
All right.
So we have Nina Hodge. I know we have Miss Conley, Miss Glover, Big Clark, and I think that's it right now. But just everybody can come on head on. And Zena, I think, and yeah, so thank everybody. Thank you guys. Thank you so much. Is there a way for you to come on camera though? Because right now, only person we will see will be those who are on camera. Oh, Miss Lagarde is on. Yes, thank
Hi, Bernita.
you. Hello, everybody. Hello, hello, hello. Can we get people to come on camera? Because if you're not on camera, you won't be seen on the actual chat. It'll just be kind of like you're behind the scenes. You'll be like a ghost voice for us. Hey, Lori. Lori is like, I was not prepared for this. Lori is okay. So everybody can unmute yourself. So I just wanted to really, really tell you guys, like, thank you for all the work that y'all are doing. Like, I know that the work that you are doing for these families is detrimental. It is imperative. Like, you guys are our first responders for families who had to go to work. And that is one of the most key things that people are saying. Like, we need more spaces. But I know that y'all whole entire lives and everything have been altered. Like, everything has been altered. The number of students, the number of staff that you can take in, pay, like everything's been altered, right? And so with that, I know that there's other supports out there, but I have the opportunity to have a virologist on, and for her to be able to answer questions for you guys, I think is key. And that's something that I would never try to keep to myself. Y'all know me. Y'all know me. I love y'all, right? And I'm always trying to introduce y'all to whatever is good. So without further ado, I'll go ahead and just open it up with saying thank you again. And introduce yourself. If we can we can start with Lori. I'm just going in one order, just for who, based on who's next to me on the screen. So Lori, just introduce yourself really briefly to Dr. Fuller. You are everybody's on mute though, so if you have to remember to unmute yourself.
Okay. Hi, Dr. Fuller, and thank you for allowing us to be on today to ask you questions. We certainly appreciate you and Bernita for this opportunity. My name is Lori Clark, and I'm with LACC Child Care Academy, and I'm a 20-year vet in the business.
Okay, super. 20 years. All right.
Yes, Ms. Hodge.
Yeah, good afternoon. I'm with Above and Beyond Learning Child Care Center. I'm on the east side of Detroit. I am working right now, so that's why I'm muted, because I don't want you all to hear this great background while I'm working.
That's fine. That's fine. Felicia.
Aw.
I'm gonna make me cry. So Felicia is with Crystal Swan. She's the owner of Crystal Swan, and she's on the west side of Detroit. Ms. Glover, go ahead.
Good afternoon, everyone. Thanks so much, Ms. Bradley and Ms. Fuller, for taking the time to share with us this afternoon. I am Latanya Glover, and I own and operate Bright Beginnings Child Care. I'm located on the east side of Detroit. I'm a family provider, and I also will be staying muted for part of the call. I do have children in care, so I'm keeping my background to myself as well. But I'm just excited to be here and share. I've been providing care for 10 years.
And then we have Ms. Conley.
She's muted.
Yeah.
Hi guys, thanks again for having us and sharing your information. But I'm Lakeisha Conley. I am a homeschool mom and a part-time director at a daycare center and on the east side of Detroit. with about now 100, well, not 100 kids anymore, but maybe 70 kids.
Okay.
So I directed.
And then
Okay.
Zena.
Hi, I'm Zena Davis with Children of the Rising Sun. I'm not open as of yet, but I've been in business for it's 15 years now. And I'm on here because I'm still closed and still trying to figure out how to open. So I do have a lot of questions, a lot of concerns, and a lot of questions.
Yeah.
Thank you.
And Dr. Fuller, so I know you did you have a PowerPoint you wanted to share?
I do. I'm just trying to debate how to best do this with the time we have. So let me quickly say, I have 3 grown-up children, 34, 27, and 26 and 26, twin daughters and a son. No grandchildren, but I'm also an ordained minister. I didn't say that earlier. So this is so important, that work that you do, and that keeping our kids and particularly in our community safe is such a high priority. So I'm grateful that you are here and that we can have this conversation. What I did not know, if you would just rather ask your questions, or if you would prefer, I have a PowerPoint that goes through some of the basics that you probably know. But as I said to Bernita earlier, sometimes, in general, we say stay 6 feet away, but why is that? Sometimes getting a visual helps. So I don't know if it's best use of our time to go through this very quickly, or if we should just have the questions. And so I'm leaving that open to you. I'm willing to do that, but I want to make it most useful to you. Thoughts?
Yes, so I would say let's go into the questions. I would say, because
Okay.
we can do the PowerPoint if there comes a time where everybody's okay, like,
Sure.
yeah, let's see the PowerPoint. But
Let's do it then. Let's do the
so we can
questions.
go ahead with Zena. You say you had a lot of questions. Whatever question you have, uh-oh.
And it may be that
They're
some of the,
working, or whoever else want to go. Go ahead. Ask whatever questions you have.
it may be that the questions also bring up points that are on the slide, and I can use them for that. So great. Let's do it.
So, you got a question? No. So you can just listen. Okay. So this is one of our teachers come in. So we're not open right now. We've had a lot of concerns about the responsibility of the parents is the biggest concern, that they're actually going to follow the protocol and be truly honest. We have a little fear of what would happen if a child or a staff caught COVID. Do we all have to shut down and get tested? And God, I have so many questions and I can't even think of them right now, but just could you give us some idea of, because I have noticed when we first started, it was an adult thing. Now it's going to the children. And I do know that sometimes the media can blow up things. And I do have peers that are open, and I haven't heard a lot of cases or any case. I just heard one. So I kind of want to hear from you, from a doctor's perspective, of what that looks like for the children, like how those cases, how, some of the statistics of how that could happen with the transmission, or even the little babies, because we're opening with just the little babies first, like maybe a group of 6 toddlers, and then we were going to practice that one and then open up to preschool and pre-K. So we were thinking about doing that. So
Right.
something.
Sure. So first of all, let me just clarify, I am not a physician. I do teach medical students, infectious diseases, and dental students, but I am not a medical trained doctor. I have paid a lot of attention because that's one of my interests that community should know. So don't take anything I say from a clinical perspective, except as an infectious disease person. So yes, the protocol that CDC recommends is that should there be a person who gets sick or tests positive, then those people who have been exposed to that person, student or child or teacher, would need to be tested as well as quarantine for 14 days. So the responsibility of parents varies. In the child care center that my cousin operates in North Carolina, the children are the parents are responsible for signing in their child and saying with that form that they sign that there are no symptoms and there have been no COVID symptoms. So it's essentially the responsibility of the parent to say, I am bringing my child here with an understanding that he or she has no symptoms that are visible, no fever, no cough, none of the things that are noted. Now, the other issue, though, is that children often, and adults also, are often infected, but no symptoms or asymptomatic.
Exactly.
So that does not mean that because a parent can honestly and transparently say that my child has no symptoms, that he or she may not be shedding virus. As a matter of fact, recent studies have shown, and these have come out in the last couple of weeks, that children may even carry more virus than adults in terms of numbers. Now, why is it that children don't get sick? We don't understand that, or why that most of them don't get sick. And we do now know there are some diseases, or what we'd say pathologies in children, the Kawasaki disease that shows up. So there's so much we don't know about this, so much that we don't know. I know that economically, for people to support their families and keep their jobs, that people need to go to work, which means that for people with young children, they need care of those children. And if they don't have family nearby, then child care centers are absolutely critical. So, because what I was going to say, if it were me, if I could make the world perfect, I would not have folks open up yet. I would have people in back the way we were in April, because that's what's going to make the virus go down, such that we can then do the things we have in hand, which is to monitor people, do testing if somebody is thought to have been exposed, do contact tracing, which means looking at the people who that person came in contact with and having them isolate until they know they either do have symptoms or they don't have symptoms. That would be that would be the masterful plan to stop COVID. But because of the economical pressures, because of the political issues, because people are tired of not doing what they like to do and normally do, and need to do some cases. People need to work. They need to pay their mortgage and their rents and put food on the table. The lockdown status is not ideal. Even so, if we don't stop the transmission of the virus, we'll never get out of this. So to answer your question, parents have to be responsible, and even being the best that they can be does not guarantee that no one will come to the school who is reproducing virus. And when someone is found to be positive, many of the CDC and many of the schools are not testing children. They're not requiring a test because, again, a test is just a shot in time. If I took a test yesterday, that would mean that yesterday I was not infected and producing virus that could be detected. But if I have done anything outside of being in my own home, I might have gotten exposed today, for which yesterday's test is no good. So it is, I describe, and I'm not being pessimistic, I just want to give you all a realistic perspective. I describe opening schools, and this is something my husband, who works at Michigan State with a program, essentially coined this term, that it's like nailing Jell-O to the wall. Mm-hmm. What do we mean by that? That the situation that we're trying to fix keeps changing. So what you fix today may not be the situation that you're dealing with in 2 weeks.
Every day it's changing, and I have to keep adapting to the changes. It's like a whirlwind, and it's like, are we ever going to get open? Because things just keep changing.
So what my cousin said, who has been in the daycare business for over 25 years, is that they are doing what they've always done, just much, much more diligently. And what she says is the culture of her school is that kids who come in, and they take children as young as 6 months, but most of them are clearly 2, 3, 4, 5, is that the culture is that you always wash your hands. You're always using the hand sanitizer. You're always, if you play with a toy, then you take that toy and you put it in the, I don't know if she called it the dirty side or what, but the used side, such that so staff can sanitize that toy before it goes back to the pile that any kid can use, because children are children. They're going to be touching things. They're not going to, you can't keep them from engaging. That's who they are. So she just, that's the culture of her center. And they've gone from 70 students to probably about 20 at this point, but they're still open.
And they've had no cases, right? And
They've had no known COVID cases. The other, excuse me, the other issue which you guys are very aware of is that even if the child doesn't get sick, the one that you're taking care of, if they are exposed to another child who's producing virus and they get exposed or get infected and they go home, if they're living with someone who is vulnerable, and now we know that's not just older people or people with underlying diseases, that could be, you know, anyone, then that child becomes a vector to bring the virus home. While that child may not get sick, it could be very detrimental and even illness or severe illness or death for someone who gets the virus from the child.
Right, right, right. So
I wish there were better news, but that's just the truth.
Right.
Is what it is.
Yeah,
Well, it's
so
glad to know that none of you had any cases. None of the providers on here right now. Nobody.
That's what I was going to ask. Yeah.
And when you
Nobody
say
had
that,
cases.
are you saying you have no cases of children, or are you saying you don't know of any cases of families of the children that you take care of?
I saw Nina was about to say something, but you're muted, Nina.
I was going to say, in regards to what Ms. Zena was saying about it, Zena, I just think that you have to just step out and within faith, because I think I didn't get anxiety at first, Zena. But speaking to Mrs. Lori Clark, I'm allowing her and I to network with one another. Like she said, get a yuck bucket. What's the yuck bucket? You know, once the kids start touching this stuff, put it in the yuck bucket. Take it
Oh,
outside.
is that what it's called, a yuck bucket?
That's cute. I like it. Yeah,
So you just, when the
The kids will love that name.
Yeah.
They love that name.
You put it in the bucket. You have your staff. You know, I had to hire some high school students. They take it outside. They sanitize with bleach and everything like that. So I understand where Zena is feeling a little bit because of anxiety. But you just got to step out with the leap of faith and say, hey, community, hey, kids, I got you. So in regards to that, when they come in the building, which I had to put petition up here, put everything up here, plexiglass. So what we had to do is like take their temperatures when they first walk in the door. No runny nose, no coughing, stuff like that. And we hear that to let my parents know, I have your back, I support you. So if that's coming through the door, I have to turn it back around. Like, no, they can't come in here in regards to
What's the name has been sitting kids that just
and
regular runny nose home.
your parents at the same time too. It's kind of scary too, Zena, because in regards to children coming back, you know, my numbers was low, but we get like a good 20, 25 coming back because I share with the parents.
That's good.
We here.
That's good.
We here to support them. We here to support them and everything like that. May I have Orlando them, please? And yeah, we use walkie-talkies for nobody walking in.
We got walkie-talkies.
In at the door, scan in and out, and that's pretty much. And then we use our outdoors. So they like to be outside to explore and learn outside versus being in this building. I did do this in order to having these parents and the kids put on their masks, especially in the building, because we got school age kids, getting them the habit to wear their mask. And what the doctor mentioned made a lot of sense, is saying, can I have that mask? I need the mask here. And like what the doctor mentioned too, that saying, just do our practices, and I'm about to say something. It's like having HIV and herpes. You never see it, you don't know if you got it or not. But do the daily practice of precaution of cleaning, sanitizing, make sure you're stepping up the level of doing what you need to do in regards to make sure everything is sprayed down, cleaned up behind it. And we don't have long hours no more, Zena. Like I used to stay open longer. Just like these stores are closed, I close at 4:30 now because we need to come in here and shine and clean up and all. Those long hours are gone. Went to Best Buy yesterday. I know I'm talking long-winded, but they were closed at 6 because they have to do their clean up. They have to go in there, organize, clean up, and go back through the stores and sanitize. And so I close at 4:30. Parents are coming on time at 4:30 to shut it down and get us ready for the next day. So I just
and remember, you're doing such an essential function for those parents who don't have other alternatives. So whatever you have to do, even if you can't be open as long as you would like to be for the hours that you like, something is better than nothing.
Then nothing.
Do
Yeah.
it safely.
Yeah. So we're actually closing at 3:30, Nina. So yeah. Yeah. When we do open.
Then you have to show them too, Zena, at the same time, how you're enforcing the safety and the health for everybody. So if that's 3:30, you just have to enforce it. I have to enforce to 4:30. Like, you must be here at 4:30. So with everybody, whatever you're doing, please stop. Send somebody up here to pick them up at 4:30.
Yeah, yeah.
They're disenrolled. Exactly.
Yes. So,
One thing that
You got a
my
question?
cousin mentioned with her center is that they use, as I think the previous speaker was saying, they use the time that they have when the kids go to sleep. So there's a mandatory nap time. I think there's a morning and an afternoon time. And, you know, fortunately kids do that because they need to. That's when they use it to clean all the tables. They have someone whose task is to clean the tables every hour, you know, and so and the kids are used to seeing that this is just the culture of the center. So if you set that as an expectation of everybody, they then go home and do, you know, tell, at least the older ones, tell their parents or whoever their caregivers are that, you know, we got to wash the table or we got to wash our hands or whatever, because that's what they know is normal.
yeah, yeah. Felicia, so I know that you've been open for a long time.
I'm sorry, I was letting the parent out. Say hi, parent.
Oh, hey, I know that parent. I know you.
What up, Bernita?
Okay.
You all right?
He said,
Hi. Forgive me, I know so many people. Oh my God, I love it. That little baby right there, she can probably teach you everything we already know right now.
12:30. We probably leave at noon.
But Felicia has been open for a while now. And I
Yes.
know when you first opened, you went through a couple where you were kind of sharing on social media, like they're not socially distancing. Like, hey, look, other providers, this is what's happening. Tell us a little bit about that experience.
Well, when I first opened, I was kind of nervous because I was sick. I don't know if I actually had the virus because I didn't go to the hospital, but I had all the symptoms, and my sister ended up in the hospital. And I have a nephew that's in the hospital now with COVID. And my licensing consultant, Miss Jacqueline Winham, she popped up today and she told me her brother died from COVID. So I was sort of nervous about opening, but I'm already anal. So I cleaned before this even came into place. I clean, I sanitize. We have stations outside. I'm gonna show you right quick.
Yeah.
We have stations.
Yeah.
We have stations set up where they wash their hands, and stations for the parents. Hand sanitizer. Before they come in, they wash their hands. When they're outside, they wash their hands. We wash down the rails, the doorknobs, the floor, everything you could think of that we touch, we wash it down. So we haven't had any illnesses, thank God. We've been open since June the 1st.
Yep, June 1st. Yep.
Yes, and I had a capacity, I'm home based, I had a capacity of 11, but now I just have 6. Because parents choose to keep, yes, parents choose to keep their children home because of COVID. So it's a family of 4 and a family of 2 that chose to stay home.
Yeah. And I really appreciate like the ones who have already opened, sharing with the ones who haven't, because that's one of the experience. We have a mom here also who's planning on helping like me do some kind of like school coaching groups also. And he's on, and these are the things we're thinking through. Like, you know, we're telling schools like you got to be on point with our babies, and so we're trying to make sure we on point too, even though it's not K-12 space, right? So, Ms. Glover, did you have any questions or anything?
No, I don't think that I have any questions. I've been open the entire time. I never closed. There were periods of times where I did not have children in care because parents elected to keep their children at home. We've been fortunate to not have any positive COVID cases in our own home, in our family, in any of the children or in any of their families. So that's been a blessing. We already had a lot of those strict policies in place. No shoes in the building, hand washing immediately upon entering. So there's been some things that we've added. The one that I think has made the biggest difference is we use the Sanitize system. So everybody that comes in sanitizes their shoes. The children have shoes that remain here that they only wear inside the building. The staff are doing the same thing so that we're not bringing anything from the outside, in. We're doing the hand washing immediately upon entering. We switched to pretty much everything touchless: soap, sanitizer, trash cans, paper towel. We do a lot of outdoor play. I think that we're taking the precautions that we were taking pre-COVID and just intensifying them. And that has been a huge benefit for us. I think my parents feel comfortable, they feel confident. Our biggest concern is we can't control what people do outside of the center. And that is the most difficult hurdle. People will tell you what they want you to hear. And that's unfortunate. If they want to go to work, if they want to, go do whatever, they're going to tell you what they want you to hear. They're going to answer the questions according to the health check. So it has to be an honor system. And it's unfortunate that everybody doesn't always abide by that, but it does come out with, the communication. If you show up with fresh lashes, you're not social distancing. And I'm not saying don't take care of you, but there's some things that are a necessity. Supermarket is a necessity. New clothes for your child that they've outgrown is a necessity. But when we are in a group setting and we're saying this is what we agree to as parents and as providers to limit our exposure, we need everybody to abide by that. For those that are not opening, I would like to encourage you. I know I spoke with Zena about this already. The first 2 weeks can be daunting. Those first 2 weeks can make you want to quit because there's so much newness. There's new procedures. There may be new staff. There may be new things happening with families. Jobs are changing. There's so much new that it's overwhelming. It's like the jello on the wall that Ms. Fuller spoke of. As soon as you manage one thing, it changes. It's like you're trying to shoot a moving target. So I would encourage anyone that's opening or that's going through that transition, hang in there. Hang in there. Once you get your staff on board, those systems perfected, it will all come together. And you just need to be able to pivot because what worked last week may not work this week. Keep your flexibility hat on, step out on faith, like Ms. Nina said, but you have to hang in there. The first 2 weeks is going to be rough. That's just the truth, So Zena, I know you can do it. I know you can do it. I'm counting on you to do it. Just hang in there. Those first 2 weeks, set your mind. It's going to be rough, but it's just the beginning. And we're going to come out on the other side stronger.
Right. Thank you. And I have a question. We were over here saying, so if you see a parent and like you said, the lashes, what do you all do? Like if you know a family has not been social distancing, how do you handle that?
So
providers?
I think it's a lot of honesty that needs to go on. Before we came back, I did Zoom calls with all of my parents and I had them sign off on my COVID policy. And we clearly said, you know what, there's no way for me to come to your home and to police what you do. That's not my job. But when you're bringing your child here, understand that what you do exposes your child who's exposed to everyone else here. So it's an honor system. We just had this situation literally last night. A mom sent out a group message inviting all of the children to a birthday party. I had a long night. Just needless to say, I had a long night and it's still going on today. And, today she did apologize and, clarify her position and rescinded the invitation and said that she was, now switching to a Zoom party. But some people need to have that reminder. And so we have to be that village to say, it's not just about you. Yes, your child, you want to do this, but when you bring your child, that means that everyone else is impacted by that. So you have to choose. Do
you turn them away? Do you turn them away? Like if you notice that they went out of town to Chicago for the weekend and they come back, do you make them quarantine for like 14 days or how do you handle something?
I have only had one, and it's the same family. The rest of my families, from what they're reporting, have been good. They've been on point. And so it's, you have that talk to say, hey, it's either this or that, but we have to make a choice because we have to keep everyone safe. Stick to your policies and reiterate constantly your expectation. And they have to choose. It's, you know, it's the safety or your convenience. You have to choose.
Yeah, because it's other people's lives at risk, right?
Yeah, we are
Dr.
all in this together. Absolutely.
Yeah. Dr. Fuller, so with that being said, can you speak to two things for me? Because we only have probably about 7 more minutes. And I know this went so quick.
I knew
you
it was
guys.
going to.
And we're going to have another segment. I hope to have continuous segments that will happen where hopefully if you guys have any questions and you want me to reach out to somebody to bring on to talk to y'all, I will. I'll do my best to. But can you speak to two things, Dr. Fuller, in our closing? One is, what are some of the new side effects that are, that are happening? Some of the newer things that are showing up, right? And then the other thing is, dang, she said it. How that 6 feet thing, like what happens when they're within that 6 feet? Because a lot of people need to hear that. They just think 6 feet, but they're still reaching over people and all that kind of stuff, right?
Sure, and there was something important that I wanted to emphasize while Ms. Glover was speaking. So all the sanitizing and cleaning and washing hands and yuck bucket and all those things are critical because the virus can be transmitted on objects to hands and face. But really, this is a respiratory virus as well, which means that if you do all that right, what you're doing is decreasing the risk, because there's still risk from people breathing out the virus as a respiratory virus if they are infected. And that is really the primary way that COVID-19 or coronavirus 2 is transmitted. So I that the bad news is that it is a respiratory virus. And I want to quickly show you this screen because I think it helps to get the idea. When somebody's infected, they're producing lots of virus. So here is an example of what the virus looks like on one cell. This one cell is producing, you just see pieces of the cell. Here's another, these are examples. This isn't even a whole cell. You know, viruses are tiny microbes that are produced inside of a cell. So one cell is producing hundreds of virus. And so these blue objects or the red objects are viruses being produced by this cell, which is brown. So imagine that even if you have a few cells in your nasal passages or your throat that are reproducing virus, and kids don't get sick when they breathe out and somebody is close by, they're going to get whatever, they're going to get some of this. And so this is an example where one person at a ski resort for one weekend that was infected and didn't know it spread it to 21 other people that they shared a house with. And those people went back to their respective countries and then transmit it to their families and their contacts. So I say that to say this is a very, very contagious virus. And the things we know to do are to prevent this sort of spread, which is this sort of thing, this distance. If somebody's coughing or even breathing without mask or without the distance, those viruses from anybody who's producing it go in the nasal passages and begin a new infection. So the things to do are to disinfect, wash hands, avoid touching face, keep that social distance, which you guys cannot do at a daycare, at a child care center, right? But you can wash hands, you can have the parents monitor their own children and let them and know when that a child or anybody in the home is having symptoms. And then of course, stay home and shelter in place, which is what everybody is not wanting to do anymore because we're tired of it. This is a virus that's spread person to person by respiratory and aerosols and by touching things where the virus is located. So I just thought, for me, seeing how many viruses are produced, and this isn't even one cell now, this is not the whole cell. This is just what the viruses look like. So to get back to Bernita's question, which I've forgotten now, can you tell me what they were? I hope that was helpful, though. To get a visual often helps me to understand things I didn't quite get before.
Yeah, it was. Oh my God, what was my question? I don't know.
Or does anybody have questions at this point that we
Anybody
can
have
close out on?
questions?
This is really hard. There's no easy answer. There's no one thing that's going to work for everyone. Everybody is adjusting and adapting, as someone said, as you go. What works today, what we do know works are the masks, the distance, staying away from people, washing hands frequently, washing commonly touched items, and prayer and people working together. If I am selfish and say, well, I don't want to wear a mask because I don't look good in a mask, I am so saying I don't really care about the rest of you. And that's unfortunate. A mask is to protect the person, not from breathing in virus, but breathing it out if they are infected. And so when you wear a mask, you say, I care about you. In case I am infected, I am making sure I keep this to myself and not put it into the general population. We know that one person can infect anywhere from 3 to 40 other people, depending on the context. So what you are doing is essential, and I believe that God will honor it if you do the very, very best you can all the time. And if something happens, you deal with it. But not to do the best you can then leaves the door open for, wishing otherwise. And I don't want that for anyone as you perform this essential function.
Yeah, so thank you, everybody. Thank you all for joining me. Thank y'all for your questions, and thank you for your service to the community. Most important, right? I mean, because y'all out there being the real G's, showing up, right? And
Amen.
showing up for years. Like these childcare providers have been showing up for years. They've been showing up for decades for families, and in that showing up, we still want you to be safe. And we want to make sure that you be able to show up for generations to come, right? And I know I can just imagine how any of y'all feel if one of your babies catch COVID. Like y'all probably would just be tore up, right? So with that being said, hopefully we'll have this conversation again soon. The Delsey Detroit Early Learning Coaching Initiative is having a town hall that I'm participating in specifically for early learning programs. And the reason why I'm pushing this for early childhood and early learning programs is because I know that y'all have kind of had a lot of support from one another, right? But y'all been kind of left out of some of the bigger, broader picture town halls and all that. And even being able to be on here like with Zena, like this is y'all sister in this battle, and y'all able to coach her through, look, baby, we got you if you need us, whatever, right? I would love to offer that to you guys as often as possible. So with that, I just thank you again. Thank you, Dr. Fuller, for coming on.
One last comment. My cousin says that she doesn't get sick because she's worked in daycare for like 30 years and her immune system must be the most powerful one because she's around all these kids. With fall and winter coming, you're also going to have other things circulating more. So my prayers are with you all, and thank you all for what you do. Keep it up and do the very best you can to honor our communities. Thank you.
Yeah.
Thank you.
So thank you, guys. I love y'all, and I will see y'all on the next go around. Thank you so much.
Thank you.
Blessings.
Yes.
Bye, ladies.
Yes, bye. So this has been the Apparent Voice, you guys, and thank you for joining us on this day. Please share with early childhood educators. Please share with providers who may not be open yet or may be open. And as you saw today, these young ladies were really supporting one another and really talking to one another about how to keep their spaces safe. I do have an ask for parents and community members. I have a serious ask. While we have these providers who are open, we want them to stay open. We want them to stay safe. We want them to have what they need to make sure that children are safe. So like they said, that the people who are deciding to go out of town and take journeys, if you know that you're doing that, bring your baby home and quarantine for 14 days. Just think about the rest of the providers. Think about the rest of the kids who they're going to be around. Like if you are honestly going to do that, like make sure for a little while your babies aren't around other kids, just to save other kids from suffering in other families. And child providers right now are very, very essential. They're like top on the list, right? And so with that being said, I thank you. Again, this has been the Apparent Voice. Please join us Friday on our Friday show at 4 o'clock. And we are leaving now. Thank you. Have a good one.